Hello, I'm Dawn Howells, Assistant Head Teacher at Pentrehafod School, and I've got Strategic Lead for Skills, Citizenship and Wellbeing. Upon receiving our data pack, the first thing we did was we added it to an item on our agenda. All of the senior leadership team were given it a week before to read through and identify key areas. Once we had done that, then my job was to distribute it to the AOLE leaders. And again, then they were asked to complete a curriculum audit based on the subtopics from the data pack. On the screen, you have the results of the Year 7 data, which we collected from the AOLE leaders. This was done for every single year group, and then my job then was to identify areas which were missing and to meet with the AOLE leaders individually. As a result of the curriculum audit, we then put an action plan together. So this is just some of the things that we looked at doing. We firstly evaluated our health and wellbeing and food and nutrition lessons and identified key areas to include from the data. The reason why we did this with the health and wellbeing is I was new in post and already looking at the schemes of learning that were there. So it seemed a very natural place to start to evaluate them and then work backwards to all the other AOLE leads, which we did. Something which we agreed on as a school is that we would actually share the data and the graphs from the packs that we were given with the students. We could show that it was student voice that were influencing the lessons, and was something which we found the students responded well to. Student voice also said that our assemblies were a little bit outdated and repetitive, so we've now evaluated them to make them more relevant to the students. As a result of the new RSE curriculum, we've had a big focus on student workshops and with the focus on relationships. We've got a lovely team in the school called the Wellbeing Warriors who have training, who are then going to be working with our new Year 7s when they come up in Year September. We identified whole school priorities and we've linked with external agencies to support our development as well. So as a result of the data pack, we restarted our breakfast club. Our student parliament team met with the canteen staff to discuss more healthy food options on the menu. We evaluated and updated the food and nutrition scheme of learning right from Year 7 to Year 11. We replaced the GCSE food and nutrition with a vocational hospitality and catering qualification. The canteen only now sell water. We have 3 new water fountains installed in the school because we could see from the data that students weren't keeping themselves hydrated. All Year 7s receive a recyclable water bottle so they can hydrate throughout the day. And we also identified that the students really wanted more places to sit down and eat and enjoy their lunch. They found that sort of eating on the go wasn't something which they liked. So we then invested in more outdoor seating areas and more indoor seats so they can enjoy their lunch and not feel so rushed. In response to the data on physical activity, we invested a large amount of money in a cardio gym. So we have treadmills, rowing machines, bicycles and a cross trainer at the moment. The reason why we did this was we were noticing a big decline in the students' enthusiasm at Key Stage 4 for PE. So we wanted to adopt a more recreational approach. We also invested in some boxer size equipment as well, which has gone down a storm with the student and really seen an increase in physical activity levels during lessons. We've also got a multi-use games area now installed at the back of the school, and students are really enjoying using that at break and lunchtime. We've seen a huge decline in our extracurricular timetable over the last couple of years, and especially as we return from COVID. So as well as the traditional sports, we are looking at alternatives. So this term we've had foot golf and cheerleading. Something which we've tried to introduce as well, particularly with our Year 9s, where we see our PE timetable reduced, is that every half term we hold a boot camp. So we've introduced the students to yoga, Pilates. This term we've got the Royal Navy coming in to do some boot camps with them. We've had martial arts instructors in and kickboxing, and we tend to do these on sort of a wellbeing afternoon with our students, and something that we try to give them a flavour of some activities which they could be doing, and something which we can either then introduce into the curriculum or something we can introduce in the extracurricular activities, or just introduce them to some clubs outside the school. And these have been a real success, particularly with our Year 9 students. With regards to the wellbeing and emotional health, we designed a wellbeing toolkit for parents, carers and students. We initially did this as sort of like a brochure which ranged from a whole range of different things of how they could get help with their mental health, to where they could get support with maybe accessing food banks, to more physical activity, to eating healthily. We found the students didn't really respond to the brochure, so we've invested some time in making an interactive PowerPoint, which we've emailed to all of the students. And the interactive PowerPoint, there is like the home page on your screen now, is where they can click on different areas, and it takes them to useful websites, useful videos which they can watch. And again, we've tried to include everything from sort of how they can eat healthily, how they can get more exercise, careers advice for the older students, advice on substance misuse, sexual relationships, etc. We try to include as much as we can, and some really useful support for them. We've really looked at our targeted interventions, and we've really looked at using the data. Are we employing the right people and the right interventions for our students? We've been very lucky that an agency called Platform approached us and wanted to work with us. Students started receiving some training from them. Platform's vision that they're sustainable wellbeing for all, and it's all very much about the young people, and it's run for young people. They worked with us right the way through lockdown. They had virtual meetings with the students. They work with them in terms of group work, individual work, and they also do some wellbeing training, which I'll discuss in a moment. So they've now embedded themselves in our school every Thursday, and they work with a Year 9 group, a Year 10 group, and then they provide one-to-one support for those who need it. And they also train our wellbeing warriors. So our wellbeing warriors, a picture of them in their orange t-shirts. That's not school uniform, that is their wellbeing warrior t-shirts. They are there to offer support to our new Year 7 students, which will be coming up in September. And they are being trained on how to do some sort of counselling with them and support. And they are going to be based in what we're going to have a wellbeing room in the school where students can go to it, be run by the wellbeing warriors. And there'll just be an opportunity there for the students maybe to complete journals if they want to, maybe if they're finding difficult navigating their way around the school, or developing friendships, or don't know what to do, and they don't want to speak to an adult. The wellbeing warriors have been trained by Platform to sort of be the first point of call, and possibly be that person, that bridge between the teacher and the support. With the introduction of the new relationships and sexuality education, we've held some workshops with our students in Year 7 to 10. We work with 30 students per year group, and they were identified by the learning leaders. And the overall purpose of these workshops was to find out what did they already know, and what did they want to know more about. And then we were really then going to evaluate what we were doing and almost rip it up and start again, because I think what we were doing was quite outdated, and we were really underestimating how much the students already knew, but also we weren't in touch with what they wanted to know. So this is an example of one of the best activities we did from the workshop, where we used red and green plates and we created a washing line. The red plates are what the students wanted students, staff, their parents, the curriculum to stop doing. And the green was what they wanted us to start doing, not just staff, but the other students as well, and the community. And again, we've tried to look at their start-stop responses, and where appropriate then we've developed this into our curriculum, but also into our assemblies and themes, and some of the sort of drop-down wellbeing afternoons which we planned throughout the year. So what you have on your screen now is the Pentrehafod School Health and Wellbeing Model. So based on everything I've discussed in the previous slides, that is really a summary of where we are as a school at the moment. So we've got on the one side the targeted interventions which we offer our young people. And then on the other side is the whole school sort of interventions and activities that we have going on for our students. This includes some of the data that we use to collect this information, the agencies that we use, the staff which we've got within our school. And this has been developed all through the data that we've received from the School Health and Research Network. So this is something which I have sort of built upon and expanded as a result of being involved with the School Health and Research Network. So from September 2021, we now have a new assemblies and themes calendar. Previously, we did all the same assemblies sort of year on year for our Key Stage 3 and Key Stage 4 students. And as a result of student voice, Key Stage 4 were quite vocal that they wanted a bit more variety, they wanted something different. So we now have a Key Stage 3 and a Key Stage 4 assemblies and themes calendar, which is very much based on the data from the School Health and Research Network and looking at some of the topics which are coming up in the new RSE curriculum. All AOLE leads have now updated schemes of learning. Our wellbeing warriors will be trained by September and ready to support our new Year 6 students, and our wellbeing room should be finished by then as well, which would be a safe place for the wellbeing warriors and for students to go. We're really a big focus is going to be looking at our targeted interventions and evaluating them once per half term. What something I've sort of reflected upon and looked in my new role is that some of the students stay on the interventions for a significant amount of time, some of them throughout their whole school time, and that would suggest to me that those interventions aren't really appropriate for them. So we're going to look at that and look at who is setting the interventions, how are they running, are they working, and we're really going to start to triangulate that to make sure that we've got the appropriate interventions for our students, but also that they're there to work for our students and they're not sort of there for the 5 years that they're with us, but they're something we should just support and they take the tools away. So that's something going to be a real focus of mine from September. We're looking at launching a new check-in service, which we're going to pilot with our Year 11s from September to October half term. And then if that works for us, then we're going to look at launching that whole school. And then with our new School Health and Research Network data, we're going to learn from some of our previous mistakes from the last time we collected the data. Last time we did it in Welsh back lessons at Key Stage 4. And at Key Stage 3 we did it in IT lessons. We sort of said to the teachers as long as they did it within a 2-week time frame, but what I found then I really was chasing people down. So I'm gonna put a timetable together this time and actually tell them what lesson they're going to do it, and almost keep a record of what lesson they were told to do it and see if they do it. And I think that will just tighten that area, so we're not sort of chasing as we get to the deadline. And then again, with the new data, that when we have it, we're obviously going to compare from the last data that we had as a school. We've already discussed, as a result of a pandemic, what we think the key areas are going to be. And then we will look then to sort of set another action plan based on the data that we receive. Thank you all very much for listening. If you have any questions, please post them in the chat and I will get back to you as soon as I can. Thank you. Bye.